All right, hello everybody. Welcome nurses. Thank you so much for being here. Yeah! We have a sea of blue out there. Awesome, let's hear it. Nurses Week. Woo! Awesome. All right. So good to see everybody here. Thank you so much. We are so excited to have the American Nurses Association in the house, along with our friends from the Florida Nurses Association. I'm Jen Ransford. I'm the Chief Nursing Officer of Baycare's West Region, and I actually have the pleasure of introducing our esteemed panel today. First off, we have Dr. Bradley Goettl. He's a dynamic nurse executive bringing more than 20 years of experience across clinical practice, healthcare administration, academia, and nonprofit organizations as the Chief Nursing Officer of the American Nurses Enterprise, home to the American Nurses Association, American Nurses Credentialing Center, and American Nurses Foundation. He advocates for more than 5 million nurses nationwide and oversees globally recognized accreditation programs. Dr. Goettl began his career in rural healthcare, later serving as a flight nurse and nurse practitioner before stepping into influential leadership roles, including serving as the inaugural Chief Clinical Officer for the Emergency Nurses Association. His career highlights include developing international training programs, securing major grants to expand healthcare access, leading innovative transition to practice initiatives and nursing scholarships. Dr. Goettl also serves as a nurse executive in residence at Georgetown University School of Nursing, reflecting his ongoing commitment to mentorship and supporting the next generation of nursing leaders. Dr. Goettl is a proud fellow of the American Academy of Nursing, the American Association of Nurse Practitioners, the Academy of Emergency Nursing, and the American College of Healthcare Executives. He remains deeply committed to advancing the nursing profession. Let's give a warm Baycare welcome to Dr. Bradley Goettl. Woo!
They gave you the long one.
All right, next is our own Stephanie Connors. She is the president and CEO of Baycare Health System, the leading healthcare provider in West Central Florida. An experienced healthcare executive with over 30 years experience in healthcare, she's known for her inspiring leadership and commitment to clinical excellence, compassion, safety, service, and engagement. Her career began at the bedside as a nurse and progressed through patient services to chief nursing officer. Stephanie then expanded her expertise to operations, serving as Chief Operating Officer for various healthcare systems in Pennsylvania and New Jersey before joining Baycare in August of 2022. Under her leadership, Baycare has grown in its role as a key economic force in the region, including launching Baycare 2.0, a corporate restructuring that allows the not-for-profit health system to swiftly adapt in the evolving healthcare landscape to meet the specific health needs of its communities. In addition, Stephanie is leading the system to expand graduate medical education, invest in specialized clinical institutes, and advance innovation. She has cultivated a thriving culture among Baycare's 33,000 team members that is focused on high-quality, compassionate care. Recently, Baycare was recognized as a top workplace in the USA by Energage and USA Today and by Fortune magazine as one of the best workplaces for women, highlighting its inclusive culture. Please welcome our CEO of Baycare and a fellow nurse, Stephanie Connors. The final member of our panel today is Dr. Trish Shikoski. She is Chief Nurse Executive for Baycare Health System. Trish oversees all nursing programs and education at 16 Baycare hospitals and manages initiatives designed to transform customer access and improve operational efficiency. As a member of Baycare's executive leadership, she manages the system's largest team member cohort and works across the system to facilitate customer access, growth strategies, and fulfilling Baycare's vision to be the best place to work, receive, and provide care. Trish assumed her current role in December 2023. Prior to Baycare, she served as Senior Vice President of Performance Excellence and System Integration at Jefferson Health in Philadelphia. She previously worked at Cooper University Hospital as Vice President of Patient Care Services and earlier Executive Director of Hospital-Based Services. As a registered nurse in New Jersey and Pennsylvania, as well as Florida, Trish worked for both Cancer Treatment Centers of America and Hahnemann University Tenet Healthcare. Trish earned a Doctor of Nursing Practice from Chamberlain University and a Master of Science in Nursing at Drexel University and a bachelor's degree in nursing from Villanova University. She resides with her husband and 2 children in Largo. And let's hear it for our Chief Nurse Executive, Trish Shikoski. I'm going to hand it over to Dr. Goettl to get us started.
Over to me. Thank you so much. First, I just want to say thank you to the Baycare team for having the American Nurses Association here today to celebrate Nurses Week with all of you. I had the honor of being able to tour the facility here today, a beautiful facility. I can truly feel the power of nursing within the walls of this facility, and have heard great stories about the care and compassion and the work that you're doing every day. So thank you and happy Nurses Week. So give yourselves a round of applause, and then we're going to get in. All right, let's jump right into the panel. Stephanie, can you tell me a little bit about your leadership journey and why you chose a career in leadership?
Absolutely. So some of you may have heard this story when I arrived, because it is one that I'm particularly proud of. I grew up in West Philadelphia, just like the song, born and raised. And my parents, both neither finishing their high school degree, my father not even advancing past, I believe, the 8th grade, did not have a life of privilege by any means. We had housing and food insecurities and the challenges that you would think about when you are in underserved communities, as well as the healthcare dynamics in my childhood really led me down a path that I realized I wanted to make a difference. I wanted to improve the lives of others and certainly make a difference in my own life and future, and raise a family in an environment that would not be as challenging. So as I thought about my career, I thought, I want to be a nurse. And I went to my father and said, I want to go to college. And the great man that he is, he reminded me that we didn't have a lot of income. My mother was a waitress. She worked 5 a.m. in the morning, sometimes not home until 1 a.m. My father was in transient jobs. He was a armor car driver at one point. And I told him I wanted to go to Villanova. Now, how many heard that the Pope graduated from Villanova University?
Yes.
Yes. Another fun fact, my grandson's name is Leo Augustine. Just really meant for great things. So my father, really tried hard, as well as my mother, to ensure that I had the future that I so much dreamed about. So my father went to Villanova's campus and he asked if he could get a job in security there. He was able to get employment, and the reason for that was because if you're employed at Villanova, back then, I don't know if this is still the case, you had tuition support. So he worked there and I applied. But when I applied, I was denied. And rightfully so. I wasn't the pedigree of the student that Villanova generally accepted. My father asked Dean Fitzpatrick if she would meet me, because he would greet her every day as she would come through the front entrance of Villanova. And Dean Fitzpatrick obliged. I met her and walked on campus and thought, number one, it would be a dream come true, but I almost felt like it didn't belong there. And I sat in front of her, and the only thing I could remember saying is, if you give me a chance, I'll make you proud. She said, take some classes in the summer, and if you receive A's, I'll accept you in the fall. I did what she asked me to do, and I was accepted, one of 99 students at the time. It was a very proud moment. My father felt ill, we had some challenges, and the dean came back to me and said, do not leave. And by the way, I was working full-time, taking a train into Jefferson as a nursing assistant while going to school. So I would work full-time at nighttime, night shift, and then I would go and do my education as a normal, traditional 4-year student. So she convinced me to stay, and I was able to have housing and food and the books that I needed. And that's a big part of philanthropy as well, and why I'm so passionate about philanthropy. But mainly what it comes down to is the dean saw something in me that I didn't necessarily see in myself. I graduated Villanova. I became the youngest chief nursing officer across the country, so they tell me, at a large academic medical center. And I was doing a national speaking engagement about change management, leading with compassion, because I'm really big on, if you're a good person, innately good, we can teach you skill, but who you are as a person makes the difference. And if I give you the runway to be your best self, then we'll be the best organization we can possibly be. She was in the audience, we reunited, had our moments, and I was on the board of the Villanova Nursing Advisory Board for a little while. Long story short, she passed away, And I sent a letter in to Father Donahue, and my story was her eulogy. And it was everything to do about her taking a chance on someone like me and making a difference. And because of that, my journey is simply that, making a difference in the lives of others, sometimes one person at a time. And in this situation, leading this remarkable organization, 33,000 plus individuals, giving you the runway to be the best of who you are. And I've had this incredible journey, not always easy, but I can tell you, because of individuals in my life that have influenced me, that made a difference, I am where I am, leading this remarkable group of individuals that I know depend on me. So that is my story.
That's amazing. That's very inspiring. And my mentor also told me the same thing. And we can't teach you who you are as a person, but we can teach you the skills. So I'm glad that you had a mentor that was the same way. Trish, why don't you tell us a little bit about your journey and what made you decide to enter a career into leadership?
Yeah, so as a young child, I had a single mom who was a nurse. And I remember, when I was very little, after dinner, she'd get her books and sit out at the kitchen table and study every night because she wanted to be an RN. So she was an LPN at the time, she wanted to be an RN. And I would just watch her work ethic, and she was probably one of the strongest, most hardworking people I've ever met in my life. And I think I got my work ethic from my mom. As I went, I knew I wanted to be a nurse because I wanted to care for others and make the world a better place. When I got into nursing school and eventually became a nurse, I worked in Philadelphia, and I had a mentor who saw something in me that I didn't see in myself. I think sometimes you're your own worst critic, right? And seeing how others perceive you versus how you perceive yourself is really important. Stephanie and I have worked together for many years, and she saw something in me, and we have gone through leadership together, and she's been a mentor to me, an inspiration to me over the years. And I just love the idea of being able, as a bedside nurse, I was able to touch one life, two lives at a time as an ICU nurse. And as a nurse leader, I'm able to make practice and policy changes and influence the lives of others and ensure outcomes for the organization. So
let me tell you a little bit more about Trish. Do you guys want to hear?
Fill us in.
She's so humble. I met her almost 30 years ago. And let's say at minimum 25, because you lose track of the years at this point. And I was the chief nursing officer at the organization she's talking about. And she was a bedside nurse. And I can remember rounding, and you probably hate when leadership comes around, and some of you hide, some of you engage, and others take the opportunity to have the voice that we count on, right? Tell us how we can make a difference, be a part of the solution. And I think Baycare is very good about that. We have the most remarkable nursing force here, and I tell everybody, you are unmatched with your compassion and dedication, and I don't need to change this culture. I walked into an incredible culture. But where I came from, it was a little bit different. So Trish, as a bedside nurse, had no problems telling me how to fix things. None whatsoever. And one day I looked at her and I said, you have so much to offer. Would you be a leader? Would you be a leader on my team? And I started to promote her within the organization because she was such a force within nursing, had such a voice to make a difference and to change things for the better. And I could spend all day telling you about the challenges we faced and the impact that we made. But you really have an incredible nurse leader in front of you, and I couldn't be more proud than to be a part of her journey and for her to be here at Baycare.
That's an amazing story, and thank you for adding on to that. I do have a follow-up, and you said you saw something in her. Tell me a little bit about when you're looking for a future leader. And what are some of the characteristics, traits that you saw in Trish, or that you might be looking into your team members for future leaders?
The first thing I look for is individuals that are innately good. I really believe your values are first and foremost. that if you are a good person and you have good intentions and you want to be a part of the solution and your voice is to make a difference, I will latch onto you so tightly and be sure that you can live to your greatest potential. Leaders are really just there to represent those that are around them in a way that enables them to be the best of who they are. You cannot teach people to be a good person. That just is something that you either are or you are not. I believe most people in our world want to be good. I believe that individuals, if they're led in a way that they can use their voice for positive outcomes and as strength, then we have an obligation as leaders to give you that voice and enable you to make that difference in the world.
That's perfect. That's that's what I would be looking for in an executive that was trying to lift me up, to being able to recognize those inherent strong leadership traits that just kind of fall right in your soul, and you can learn the rest of the skills. I think that that's amazing. I do have a question about your leadership style, because she's noticed something in you, but I'd like to hear from you. How do you describe your own leadership style?
I think of myself as an authentic leader. I like to live by values. So values are very important to me. I think I represent the values of Baycare. So honesty, integrity, trust. And as a leader, it's just so important to live those values every single day. And
you're all leaders. Every single one of you are leaders. We may have the title as a leader, but you're leaders. And use that to make the difference in the patient's care that you impact every single day for each other. Like, think about it during the hurricane. Here's a great leader. Great leaders don't run from the problem. Great leaders run towards the problem. And when you think about our workforce, that's why I say all of you are leaders. The care that was delivered during one of our most trying times, 2 back-to-back hurricanes, and then everyone who stepped in to our best of our ability to get gas. We couldn't get it at every location. We were very dependent on the state and the support, but they did the best that they could to support us. We had multiple locations. We had the food drive, so we were giving food not only to our team members that had terrible loss, but to the communities. So leaders run towards the problem. They don't run away from the problem. And each and every one of you are leaders in your own right.
That's amazing. And I think you probably touched on this in what you just said, but you hinted at that leadership isn't all glam and glory all the time. There are rocks, there are challenges. And I'd be interested to actually hear from both of you how you best approach a challenging situation and how you actually pull in your team members into that solution.
Well, it's so important to get the voice of the frontline nurses, their insight, because they see the challenges on a day-to-day basis. They see the practices, the policies, and the issues. I didn't want to say issues because I think everything is solvable, but they see the problems on the units at a daily basis. So I think having that voice and bringing that voice to the forefront is just so important. So listening is the most important thing that we can do when there's a challenge, and getting their opinion on how we can solve those challenges.
I'll elaborate on what Trish had said, because I agree with her wholeheartedly, that if we think as individuals we have all the answers, we will fail you, because we are one person. And really, when you look at history and the impacts that leaders have had, it's because they surround themselves with really talented individuals. And for me, that's 33,000 plus individuals. So when we have a crisis, the number one thing a leader has to do is to tap into the resources that are around them and depend on them, and to listen to them and to enable them to be a part of the solution. If we do that consistently and give you the ability to solve, you're 33,000 strong, and across the nation, much stronger. Yeah. And the voice that nursing can have is pretty incredible. So both of us, and I think all of the leaders within Baycare I can speak for, are, the leadership style is, number one, participatory. We don't run from the problem. We're front and center. We'll pump the gas, we'll hand out the food, we will stand by you and deliver care if necessary, and we will work side by side to ensure that you have the tools to be able to live through any crisis. And an example of that is what we did during the hurricane, and I can talk about that often, and I will talk about that probably through my whole journey as a leader of Baycare, because I was so inspired by each and every one of you. When crisis hit, you didn't just look at yourselves. You had to leave your families. You had to come through these doors and take care of total strangers. That's leadership. So when I tell you leadership, I may have the title, but you are all leaders.
Yeah, the resilience that comes out of that type of natural disaster and people showing up, you learn these lifelong skills, and the people that never thought that they were leaders, all of a sudden they rise to the occasion, even in an informal way, and they truly become, the shining stars to help lead a department or an organization or an initiative. I'm curious if I can hear from you, Trish. How do you advocate for your nurses? As leaders, we kind of get further and further away from the bedside, and sometimes it's hard to, keep your finger on the pulse of the day-to-day of what the bedside nurses are experiencing. And I'm curious, how do you take purposeful action to really understand their day-to-day?
So it's really important to be present, to be rounding, to hear the voice of the nurses, hear the input from the shared governance councils that we have, which we have so many voices of our nurses in shared governance. I'm lucky enough to be able to sit at the CEO cabinet. Stephanie has elevated nursing to sit at the cabinet, so I report directly to Stephanie. So I have a say when we're talking about the strategic initiatives of the organization, when we're talking about what's important to our future for Baycare, how as nurses we want to show up as nurses in the future of Baycare. I'm very privileged to be able to sit at that cabinet and represent our bedside nurses and bring their voice to that cabinet as we're talking about our strategy and our future and our practice and our patient outcomes.
That's great, and it really goes into my next question about how do you best advocate for nurses, and it's great that you have a leader that's a nurse, that you guys can, understand where you guys both came from and be able to understand the workforce. I'm curious about some of the larger conversations around workplace violence and health equity and well-being, and some of the initiatives that you guys have taken. Maybe Stephanie, I'll turn it over to you. Some of the initiatives that you guys have taken here at Baycare to address those particular issues, which are a hot spot all over the country, or a hot issue all over the country that we're all trying to solve. So I'd be curious to hear some of the best practices from you all.
First, let me share that 2024 was our best performance year in our history. And I don't know if you all know exactly what that means, because when I say performance year, you may be thinking about financials. And I'm not referring to that. I'm referring to the highest safety, service, quality, engagement, and every indicator that's necessary to ensure that we have a workforce and a team that individuals want to be a part of, right? So when you think about the future of nursing, what's most critical? What's most critical is being the best place to work and practice. That's most critical. I always say patients originally come for the physician. You all know that, right? But they stay because of all of you and your extraordinary care. And they come back because of all of you and your extraordinary care. So those outcomes are something to be very proud of. So what do you think? Our best year in our history, 2024? That's pretty good.
That's pretty
That
nice.
deserves something.
Something to be proud of.
And, our CFO just recently did a Becker's conversation regarding our performance, and here's what she said. We have a nurse at the helm who understands clinical, who understands what our workforce needs. So when we are going through difficult times, such as workplace violence, such as the vulnerabilities and risks that we have with new legislation, or our mental health of our workforce, all of those challenges that we face, as a clinician, I can tell you, we take those very, very seriously. So workplace violence, it's a really tough one. When you think about all the rhetoric that's out there on social media, by the way, I'm not a fan of all the rhetoric that's out there on social media. I think if somebody has something to say, they should have the courage to say it to the individuals that can influence and not hide behind social media. And hiding behind social media makes our environment more challenging, because how do we solve when we don't get to the root of the problem. So when you solve issues like workplace violence, and an example of workplace violence can be through social media, and we have to figure out how to manage that because that is challenging. So threats and vulnerabilities, but then there's the extent, let's go away from social media and think about the live situation where individuals come into our facilities. So all of our facilities that are hospital-based have weapons protection, and we're looking at advancing all of our weapons protection systems because we believe that we have to do foundationally what we can do. But this world is challenging, and it always has been challenging. I say to people when they say it's the most challenging time in our history, I tell them to watch those series of 1820s, 1920s, and you look back and you can say, okay, well maybe it was a little more challenging. A little more challenging. We can figure this out, but we need to get to the issue, and we need to solve those issues. So can we solve all workplace violence? I'd be lying to you to sit in front of you and say we have the answers. Here's what I will tell you. We can put all the weapons protection systems in place. We can put all the policies and procedures that we think will be effective. But traditionally, when something happens, you don't see it coming. So what I will tell you all is, see something, say something. Be the biggest advocate for those around you. If you see challenges that are out there on social media that you think are going to lead to an adverse event, say something. If you see something in your environment when you're walking into the building and you think it could turn into something bigger than what your eyes are telling you at that moment, say something. It is so important that as 33,000 strong and millions strong in our nation, that if we all stepped up to say something when we see something, I believe the world would be a better place.
Yeah, I appreciate that. This is such a struggle all over the country, and it is one that has risen to the top for nurses. And I interact with nurses every single day who are telling me about their experiences and their reluctancy to stay in the workforce. And we are working hard, at the local level, the national level. And I see the work that you guys are doing here. I walked through the weapons detection device on the way in. And those structural things really do make a big impact. But just a culture of reporting and feeling safe enough to step up and do that and having the support of your leadership is very important. So thank you very much. Maybe you can talk a little bit about the work that you guys are doing around wellness and well-being.
Yeah, so we're doing a tremendous amount of work but before we go on to that, I just wanted to say what an advocate Baycare has been in legislation for pushing standards for workplace violence in the nation to ensure that our nurses, that there's repercussions for violence against our workforce. So to talk about our well-being, which is super important, nurses have a really, really hard job. They come to work and they see things and they experience things that many other professionals will never see. And we see it on a regular basis. So it takes a toll on us emotionally, mentally, physically, the long hours. So nurse well-being is just so important to build that resilience to ensure that you're fit to be able to both physically, mentally, emotionally, mind, body, and soul to endure a long career in nursing. We have Stress First Aid, which we're rolling out, is a great peer-to-peer program for well-being where peer members can identify someone who's having a stressful day or stressful event, and they can give them the tools that basically provides a toolbox for them to be able to de-escalate them, help them come out of that stressful event, and give them the support and resilience that they need. So it's different when there's a leader who's helping someone go through a stressful event because they may not have the same insight as a peer member who can really relate to that person a little bit more. So this is a really special program that we were able to put into place for that peer-to-peer support, which is really valuable. Our nurses really like it. We have multiple initiatives that we've, well-being rooms. We have all sorts of different initiatives that we have put into place at Baycare, and with our new well-being certification, which is wonderful. We're so excited about that.
Congratulations.
Thank you. That certification validates that we're doing the right things, and our team members feel that we're doing the right things, which is the most important thing. Because if we can put any initiatives we want into place, but if our team members aren't feeling it and they don't feel that they're being supported, then what good is it, right? But this certification validates our team members feel like we're doing the right thing for them to ensure their well-being and support them.
Yeah, and that's hot off the press. I mean, you guys were just celebrating that last week, so
yes.
Congratulations.
Thank you.
Commitment to this work is very, very important. Yes. And that external validation really raises the bar and sets the standard, and you guys get to be among the first in the world with this type of accreditation.
And the only organization in Florida to receive it, so very exciting.
Yes.
It's a testament to the hard work and all the activities that you guys are doing, supporting each other from a peer-to-peer level. So that's really important.
So that shows the commitment that this leadership team has to your well-being, but also your commitment. So some can sit in the nursing profession, and obviously there's a lot of opportunity for the nursing profession, right? When we talk about workplace violence and we talk about the mental health of those providing care, being in vulnerable situations, and how do we do that better? There's a lot of things that we can do better as we progress in the profession. What that takes is all of you. It takes all of nursing. And we'll go back to you having a voice. This doesn't mean that we're perfect. I do believe that we're better than most, and I do believe that we are an organization that is chosen because of our culture and our compassion and what we're known for. But there is always opportunity, and we're wise enough to know, as nurses and as leaders, that every day is a new opportunity. And sometimes when you fix one problem, another problem arises. Or you can fix one problem and 100 people love it, but 100 people do not. And when you have tens of thousands of people that are involved in a decision, or when you have tens of thousands of people that are depending on you, it really takes all of us to help those around us to see the efforts and the energy around this profession and why it's so amazing. So with all of the challenges we face, just think about what you do every day. You're making a difference in the lives of others, whether that's the patients you're caring for, whether that's the families that are by their bedside, or whether that's your peers that you're standing next to. You're making a powerful difference. You've chosen a noble career that I believe is the most incredible dedication that a human can give, which is saving the lives of other individuals. So some days it'll get really, really hard, but you need to know that all of you in this room and nursing across our country, that you are appreciated and you're valued, and our voice needs to be heard, and we need to continue to make a difference. And every time we get in front of you in the future, I'm sure we're going to be able to talk about how much of a difference you're making.
Thank you for that. And it's so true. The work that's being done here and the work that's being done around the country to improve well-being for nurses can't stop. And it's not just done in programs, it's operational logistical changes that make the work environment easier for nurses to be able to do their everyday work. And some of the innovation that I've seen here as I've been touring with the virtual care unit and some of the new facilities that are coming on board to reduce kind of the burden of crowding and being able to serve your community really shows your guys' commitment to this space. If you could give, Trish, I'll ask both of you. Trish, if you can tell one piece of advice for one of the future leaders in this room or a leader in this room that's aspiring to grow their career, what would be that advice?
I would say be flexible, be resilient. So the healthcare landscape is ever changing. The only constant about healthcare is it's going to change, right? So having that flexibility, we know you have the dedication, we know you have the heart, or you wouldn't be in the profession in the first place. For an aspiring future leader, it's important to be flexible, but most important, never lose that compassion or empathy, because as a Baycare nurse, I know that's what sets us apart from everybody else. All our other competitors are the compassion and the empathy that our Baycare nurses have, and continue that in nursing leadership as well.
Really well said. I would echo everything that Trish has mentioned, but I would also say, use that fire in your belly. When people say, why did you pick so-and-so for their journey in leadership? Because I have a lot of opportunity to choose leaders. And throughout my career, I will tell you that I've chosen very amazing individuals to be leaders, but that's because they earned it. And you can open the door, but how you deliver on service to others is because of all of the things that Trish mentioned. So use that fire in your belly. The last thing I will say, my advice to you is, this is how I feel. So I have 4 beautiful children, a husband of 30 years, 2 amazing grandchildren, 1 on the way. And I will tell you, my legacy on this earth will not be that I was a CEO. My legacy on this earth will be, hopefully, that I was a great mom, a great wife, and that I made a difference in tens of thousands of individuals on this earth because of the compassion that I so much believe in. So if you go down your journey being the best of who you are in what you do, and you only answer to yourself when you look in the mirror every day, knowing that you lived your best life, one day when our time is over, I would hope that all of us can reflect on the difference that we made in the lives of others.
That's amazing. Yeah, thank you for that. I'll add one of my own comments is, don't underestimate the impact that you can have in somebody else's life. Now I'm at this stage of my career, I hear from a lot of people that say, I interacted with you, at this job or this job, and you made an impact, you made a difference. So you can make an impact in the person sitting next to you without even knowing that you're doing it. So just be kind. That's the one thing that I'll add, and lift people up when they're down, give people opportunities, and we can all rise and do this work together. We're getting down to the last little bit, but I do want to hear from you. How do you describe the power of nurses?
Yeah, so this will be a fun comment to make. So think about this. I grew up in the inner city. I was poor. I'm a female. And I'm now the CEO of one of the largest, most remarkable health systems in the country. That's pretty good, right?
Yeah, pretty powerful.
And so never be underestimated. That's what I would tell you as a nurse. So as a nurse, we didn't traditionally sit in CEO roles, right? So my whole background, if you looked at me from a child to my entire background, I wouldn't be the poster of the CEO of the future, 2025. But today, when you look around, healthcare is built with nurses as leaders. That really says something. So I will say, don't be underestimated. You have for my male colleagues in the room as well. I only use it as an example because I'm a female, but for my male colleagues in the room as well, don't be underestimated. All of you have the ability to do whatever you dream of. And that little girl that grew up in the inner city that thought that that was normal and that was going to be my life, to the life that I live today that I so much am grateful, I'm incredibly grateful for, is all because of resilience. It's because of courage, and it's because of that fire in my belly that I knew I could do more. So I will tell you, use all of that, and don't underestimate the power that you have. Your power is pretty extraordinary.
I would second that. The influence that you have as nurses is incredible. Not only do you influence the patients and families every day that you care for, you influence the communities. You're educators for the communities. You influence policy, healthcare policy. You have the power to influence national initiatives. There's so much that you have that you can. We are the largest profession in healthcare as nurses. We're also the most trusted profession in healthcare, and there's a reason for that. And we have a lot of influence in legislation, in communities, in day-to-day practice. So never forget that.
The last thing I will say is, don't forget the words that you're all leaders. So although we're sitting up here and we have the privilege that you can depend on us as being a part of Baycare, you're all leaders. And when I became a nurse, the day that I passed my boards, I thought I hit the pinnacle. And if I didn't go a step beyond that, I would be as happy today regardless, because my dream was to be a nurse. I am a nurse first. I will always be a nurse. And you have a lot to be proud of with holding that badge of honor.
I can feel the power of nurses right here on this stage. So thank you so much. And I can feel the power of nurses in this room and in this building. So I appreciate you having me here today to be able to have this discussion with you, learn about each of you, learn about the health system, learn about your leadership and the future leaders of this organization. And I understand that there were some questions that came from some Baycare nurses. So we'd love to, see if we can get through some of those.
We do have some questions for sure. So we have a question first from a clinical nurse 3 at St. Joseph's Hospital South. How will AI transform and enhance the nursing profession? And what are Baycare's strategies for incorporating its use in daily care delivery?
Great question.
So I would say, sorry, I'm going to take this one first. AI will enhance and create nursing efficiencies. AI will never replace a nurse. It can't replace the human touch, which is so important in caring for our patients. But AI, we know that nursing is a hard job. We spend a lot of time documenting with the electronic medical records. We saw this shift from people talking to their patients to putting their heads in their computers and documenting everything real time. I think there's so much opportunity to use AI to make your job so much easier. Not to replace our nurses though, because our nurses are invaluable. That human touch is so important. Your education or your skill set, everything that you've learned cannot be replaced by a computer. Sorry, you go ahead.
She's passionate about that, right? That's pretty good. I told you she's passionate. When I first came to Baycare, one of the initiatives was AI voice technology for the bedside. And we did this press release, we're going in. We're gonna do a nurse voice so that you didn't have to spend 30-40% of your time in the computer. Well, that wasn't as easy as it seemed. The first company that we hired wasn't very successful at it, so we had to pivot, and then we went with another company, and now we're with 3 companies that are piloting in that space. And the reason for that is not because of anything more than what Trish said. You have the ability to do exactly what you were born to do, which is that human interaction, that care of the patient and the family. And if we keep you in your heads down in the computer, we're taking away from what we know our capability is, which is to make a difference by connecting with individuals and making that eye contact. And no matter how hard the situation gets for you as a clinician, we want to make sure that your first priority is in the room with the patient and not with the computer. So AI is not a bad thing. It's going to help us to be able to take some of that pressure off of you. But as Trish said, and I don't need to repeat it because she was very passionate about it, computers and robots cannot replace nurses. And so that's the rhetoric you hear that I say. This is why I don't like social media. People will, do you know I read something that said that AI will replace doctors? Well, tell me how that's possible. I mean, really, is that possible? That is not even logical. But if you put it out there and you put the noise out there, what's going to happen? Physicians are going to get concerned, and then you could drop the enrollment into the medical school because those future physicians will think, well, if I'm going to be replaced by a computer, why am I going to work so hard to go through school? And then next thing you know, we're going to be faced with hundreds and thousands of shortages because of the rhetoric that gets put out there. So we have to create clarity as leaders to say where we think AI fits. And where AI fits is to support you so that you don't have to do those menial tasks.
Yeah, definitely. Sorry, I definitely think reducing cognitive burden, helping with clinical decisions, maybe safe. We all know. I mean, 12 hours shift, you start to go foggy a little bit, and technology where it can help us pick up subtle things, early warning systems. Those things have been integrated into our work for a long time, and that's artificial intelligence. So if we use it the right way, it will make us a stronger profession. Give you more time at the bedside and maybe get you out on time or be able to spend more time with your patients. I think the other thing is on a national level is nurses have to be at the table when the technology is being developed. The companies that don't do this great don't have a clinical person at the table to really answer the question or find the solution that we're looking for. So we continue to advocate to make sure that there's chief nurses and nurse leaders involved in these technology companies, and that they're really solving the problem that we're all looking to solve.
And as we help to create these AI nurse dictation, nurse voice technologies, we want our bedside nurses at the table. Yeah. So we actually went back to them. They came to us as leaders and said, "What's your thought?" I said, "Go to my nurses and ask them what they want." So because you have the most valuable insight, you see it every single day. You know what works for you and what doesn't work for you.
So these companies, we're building the product with them. So that's what's going to make it so successful, because all of you are living it day in and day out. The company that needs to build the product for us needs to respond to what our needs are, not what the computer is telling them the needs are.
I think there's other interesting places, and I'll let you get to the next question, but around discharge teaching and health literacy and translation and making sure that we're getting the right information for patient teaching and being able to do that quickly. We know sometimes it's hard to be able to communicate with certain patients. We're not the best at letting all the medical lingo go. There's a lot of ways that we can integrate this, even in education, nursing education, the use of bots and deep fakes to do lectures, and there's a lot of cool stuff out there. I'm excited to see what's going to come as long as we have some guardrails around it.
And the other thing, I know we need to move on, but it's important because it was asked, the important topic. The tasks that you have that don't enable you to work top of license are a lot of regulatory tasks. We have to do it because we have to meet those regulatory requirements, which is important because it's around patient safety. So likely an event happened somewhere in our world, and now we have to document specific indicators because we need to protect our patients because we don't want another bad outcome. So we learn from this. So when I say these tasks, that the computer can do them for you, it's because you can accomplish what we need to accomplish to improve the safety of those that we serve without you having to physically be documenting in the computer. It can be heard through your voice and through your assessment. That's what we mean by that. So we have the ability to meet all those regulatory demands in a more efficient way.
Wow, that was excellent input. Thank you. Thank you so much. Honestly, that is the future of nursing, and I don't think any of us in this room got into nursing to do documentation and charting, and if anything can help us with that, I think we're on board for that for sure. Thank you.
Bring the nurses back to the bedside.
That's right. Make that connection. This is a question from a nurse manager here at Morton Plant Hospital. It says, HCAPs are a crucial component of healthcare systems. What strategies have been implemented in larger organizations like Baycare to consistently achieve high scores across all campuses?
So we have multiple initiatives. I know the priorities that we have are the must-haves in nursing, which are evidence-based, proven to increase HCAHPS, or the bedside rounding, the bedside shift report. We have, you live it every single day, right? I do think that from a national perspective, I'll let you speak to the national perspective, but the most important thing for us is having our nurses at the bedside, caring for the patients, that compassionate, empathetic care that we spoke about, our Baycare nurses are known for, doing the right things for the patients, being there when they need us, will always improve those HCAHPS scores. And it is so important that our nurses are what drives the HCAHPS scores, because we're with the patients for the majority of the time. So the doctors come in, they round, and then they leave. But face it, the majority of the patients stay. They're with you. You're their caregiver for the majority of their stay. So you have the influence to raise those HCAHPS scores.
And before we talk about the national, I will also say that Trish and your chief nurses across Baycare are very focused on your ratios. We understand that ratios are important. And I will tell you that for those that have only worked at Baycare, sometimes you're not able to see what's outside and what's happening in the world with the shortage of nursing and inability to get nurses at the bedside. And it's not that we don't have those challenges, But for the most part, we are so focused on nurse-patient ratios because we know that's a big part of the care that you need to deliver. That's the optimal care that drives the patient engagement. Because if you're not able to spend time with that patient because you have too many patients, there's risk associated with that. But the main risk is the gratification or the engagement of the patient, or ultimately the experience of the patient. So I never hide from the topic of ratios. It's always a tough subject in nursing, but I can tell you have a leadership team all across Baycare that focuses very heavily on filling all of the vacancies that are out there so that we can give you the proper support that you need at the bedside.
Yeah, the focus on, human-centered and patient-centered experience, the more time that the nurse has with that patient, optimizing operations efficiency and throughput, getting patients discharged in a timely manner so that your front end isn't clogged up, getting people to a room so they're not having to hang out in hallways. All of these things that help move the patient through the system, but also optimize the amount of time that the nurse gets to spend with the patient. Not only does that improve the patient engagement scores, but we know that that improves quality of care. It decreases mortality and morbidity throughout the health system. And as long as those things are optimized and we're able to work together to be able to move patients efficiently, and ultimately patients want to be back in their home anyway. So the faster that they can recover from their injury or illness and get back into their home and back with their family, and they're able to have timely follow-ups and make sure that they have good discharge instructions so they understand how to take care of themselves, not only to recover from a specific illness or injury, but to be able to continue focus on their wellness and health into the future. I think if we focus on that human-centered experience, that patient-centered experience, then the HCAHPS scores follow.
And being advocate for your patients, but it's a great time to put in the plug for the purposeful hourly rounding, bedside shift report, all those great things.
It's also important to put in a plug that we are nationally known as being ranked incredibly high in this space. I can't tell you the countless organizations that want to come to Baycare to see how do you get scores at that level. And what we tell them, it's our people. Your compassion and your dedication to what you do every single day. Ultimately, it goes back to what I said earlier. We're hiring the right people. We know that you hold the values that are so important, and our community feels that. They feel your love and they feel your compassion.
Happy nurse, happy patient. And that is the power of nurses.
The power of nurses, indeed.
We say that all the time here, actually. A happy team makes happy patients. So it's great that you brought that up. Thank you. Any last thoughts from each of you?
Well, I would like to thank all our nurses during Nurses Week. Thank you for everything that you do. It's a hard job. We know it's a hard job. We appreciate you, and thank you. I hope you are having a wonderful Nurses Week.
What I would say is I'm so honored to be among all of you and to consider myself one of your colleagues and to be a nurse, to be in this room with so many of you that took time out of your busy schedules. It's overwhelming to me. It feels I feel such a sense of pride because this is the level of engagement that differentiates us as an organization. The day I said yes to coming to Baycare was the day I walked away from 50 years of living in the same place, raising my family, and picking up and moving to a totally different environment that was a lot of unknowns. Fortunately, my entire family came because that was the deal, that everyone had to come with me. I wasn't going to leave anyone. But this is my home, and it's my home because the culture that's here, I can feel the difference that you make, and it feels so much a part of who I am that I feel like I've been here my entire career. So thank you for that. Thank you for your dedication, the love and compassion that you showed to this community. I couldn't be more proud than to say that I lead this remarkable organization.
And from the American Nurses Association, we are so grateful to be able to be here today with you to celebrate this experience and Nurses Week. I'm honored to be able to see your facilities, be able to celebrate with you all and the 5 million nurses in this country that are also celebrating this week. It's hard to believe that there are 5 million nurses, 28 million in the world. We are the most trusted profession for decades, and we're gonna hold that true for the years to come. So thank you so much for allowing me to come here and celebrate, and we're excited to continue to work with you, and congratulations on the well-being accreditation.
Thank you so
Now
much.
give you all a big round of applause.
So I want to just take a moment to thank everybody on our panel, our amazing nurse leaders. Thank you so much, and our amazing CEO. Thank you so much. As we end today's session, I'd like to take a moment also to thank the nurses in the room and those listening around the nation. What you do is truly a gift. You make a difference in the lives of so many. Thank you for choosing this noble profession, and we wish you only the best. Thank you, and have a wonderful day.
Happy Nurses Week.